Ladies and gentlemen, I'd like to welcome you to this session, which is entitled Understanding a Patient's Role in Sudden Cardiac Death Therapy Preference and Clinical and Psychological Post-Implant Implications. Now, that's an awfully long title for a much more gentle subject, and I'm delighted to welcome Miss Lindsay Davis, who's no less than Miss Ohio. It's not every day I get the chance to sit on the same podium as a beauty queen. In fact, I can be pretty confident this will be the last chance I get to do that, so I'm going to make the most of it. But Lindsay is extremely brave to come here and tell us her story. It's a very compelling story about living with an implantable defibrillator. So with that, I would be very grateful, Lindsay, if you could begin to tell us a little bit about your story. What happened to you?
I was a ballerina my whole life, dancing about 7 days a week. And when I was 17, I started having these symptoms. I was passing out, I was over-fatigued, I couldn't get my heart to calm down, and my coaches and teachers all thought it was overexertion, lack of training, dehydration, that I didn't eat enough. And it was after dance class one day that I was just walking down the hall at home and collapsed. And they took me to the Cleveland Clinic and diagnosed me with hypertrophic cardiomyopathy.
So when that diagnosis was made, what was the advice that you were given straight away?
That I would have to give up dance. It was very hard for me.
And how old were you then?
17.
So that's quite a difficult thing to take on board as a 17-year-old.
It was. That was my plan. I was going to go to Juilliard, dance with the Paris Opera Ballet, and then plot twist.
Okay. And after that, how did you get to having a defibrillator? What was the next stage in the process and the discussion?
We tried medication for a few years, and I had some episodes of fainting, and they decided that I needed a transvenous ICD implanted. So I talked to my doctor about that, and he told me this is very routine for people that have your condition. It's very safe. You're going to feel safe. You're not going to have to live with this fear that you could just die at any moment. This will be your backup plan. So I was very confident in that ICD.
And how long ago was that ICD implanted?
That was about 9 years ago.
And would you mind telling us a bit about the actual implant, what they did, and what your experience was? So how did it get implanted? Where was it put?
Oh, the traditional ICD was implanted behind my breast because I was doing some modeling work at the time, and they didn't want it to be visible at all. So the incisions were placed where you would with a breast implant, and you couldn't see it at all. It was wonderful.
So a pretty good job.
They did a great job.
And how long did that last for?
About until last year. I was in New York and I was walking. I started feeling a little bit fluttery in my chest. Started getting a little bit dizzy, so I sped up. I saw a bench in the distance. I passed a woman and really tried my hardest to force a smile. And the next thing I knew, I was lying on the ground in the middle of a busy New York street. My ICD had inappropriately shocked me. They took me to the hospital, and it was determined that I had a lead fracture and that I would have to have it replaced.
Any idea how that lead fracture happened? Was there some specific thing that you think brought it on?
I mean, I think I pinpointed it to having to carry a suitcase that was bigger than I was, but I'm not really totally sure.
So you had an inappropriate shock. Is that a phrase that you've learnt, or did you know that it was an inappropriate shock at the time?
It's a phrase that I've come to learn. Immediately when that happened, I had my smartphone in my hospital bed. I started researching. I'm someone that needs to be as educated on everything that goes on in my body and goes into my body. So I started learning what my options were, that you could have the leads taken out, you could leave them in and just have another lead placed. But I didn't like that option. I thought there's chance of infection, you could have another lead fracture. There's just so many things that could go wrong. So I wanted the leads out, and then I started looking at lead extraction surgery, which terrified me.
And why did it terrify you? Was it because of the discussions you had with your physician or what you read? What was it?
I was put in touch with some specialists through colleagues at the British Medical Journal, and they were all telling me, like, yes, you can have this lead extraction surgery, but most young people build up a lot of scar tissue around it, as well as females. And I was like, okay, well, I have both risk factors. And then I started looking at statistics, even at the best hospitals in the world, 1 in 100 chance of having a complication. I was so sure if I had this done, something was going to go wrong. I was terrified for weeks.
Okay. So you opted to have the lead extraction, and what was that experience like?
Well, I also was researching a lot about what would go in after the lead extraction. And when I was talking to all these different specialists around the world, they were telling me, you know, there's this new device, the SICD, and if you were to have this, the leads don't even go into the heart. And it's a much less invasive and taxing on the body. And I really liked the sound of that, but I was kind of scared about the fact that I was in a beauty-based industry and you could possibly see this device.
So that discussion with your physician then, did that take place before the lead extraction about the choice of an SICD?
This was actually all on my own. I didn't even
Okay.
talk to my physician before this. I was crazy on the internet and talking to different specialists. I then had my appointment scheduled with my EP, and he walked into the office, and I just started talking a million miles a minute, telling him how I wanted the SICD, I want the lead extraction. He's like, wait, if this had been around the first time I implanted you, you would have gotten this device, 100%.
Okay, so he was very clear that that was a good choice for you to have.
Yes.
Were there particular things that you wanted to think about when you had the SICD implanted, in terms of the location of the implant and that procedure? Did you have discussions about that with him?
I mean, he knew that the industry that I was in, and he knew that it was going to be a big deal for me to have something that was sticking out of my body. And they took everything into consideration. They worked with a plastic surgeon that did the suturing. But yeah,
So that turned out well.
it turned out very well.
And you've had it in for how long now?
About a little over a year now.
And comfortable? Any problems? Any
I have
issues?
not had any problems. Honestly, when I first had it implanted, I was a little bit scared because I had just gotten over having an ICD in my body, something I had no control over, shocking me. And then I had also, like, through my crazy researching, I had read about some people when SICDs were first implanted that were having some inappropriate shocks, and that scared me. But luckily, there's a better screening protocol now for that. They're very stringent with who can have them.
So what were the key things that made you want to have the SICD as opposed to a replacement transvenous device? Because it doesn't last as long.
It doesn't last as long, but I never want to go through what I did ever again. I know it can be a rare thing that you have a lead fracture, but to even be put at risk of having the lead extraction and all of the complications that can come along with that, and I just never want to go through that again. It's just much easier with this device. If something were to go wrong, it's a simple surgery to remove it.
So it sounds to me that when you went to see the electrophysiologist that was looking after you, you had a pretty clear idea in your own mind about what was going to happen to you.
Yes.
How did he or she react to that?
He was excited about it. He wanted me to have the device. My dad just wanted extra reassurance. He asked him, if this was your daughter, what would you do? And he said, I would absolutely give my daughter this device. It's wonderful.
So, given the experience that you've had and the choices that you made, how has that impacted on your perception of services generally to prevent sudden cardiac death? What have you done from your experience that has contributed to understanding of prevention of sudden cardiac death? Can you tell us a bit about that?
Sure. Well, I feel very blessed to be here still. And I'm very adamant about giving other people the same chance that I've been given. So I went on to pass a legislation in Ohio called Lindsay's Law that protects student athletes against sudden cardiac arrest. It's an education bill that educates coaches and parents and teachers the signs and symptoms to look for of an underlying heart condition. And I also passed a CPR mandate in Ohio that makes it mandatory for all graduating seniors to be proficient in CPR and AED use.
That's pretty remarkable.
Yes.
And
Thank you.
what about your other activities in writing?
I also write on the topic of sudden cardiac arrest and CPR for Sports Illustrated and USA Today, and I work with several different organizations that provide screenings for free.
So you're in a pretty good position to speak about the patient experience, clearly, and also a unique position to talk about advocacy for prevention of sudden cardiac death. Do you think that the way that physicians generally handle this, from what you hear from other patients or other individuals who have defibrillators, do you think we're doing a good job, or are there things we could change?
Well, you guys are great, but I do get a lot of people on my social media because I've been very vocal about my journey with this, and I have a lot of people asking me questions. They're mostly women or young men that are embarrassed to ask certain questions to their physicians. So they come to me and they're like, can you see it? They just want to know about like wearing certain things. And they want to know about the effect it has on relationships with their boyfriend or girlfriend. They just want someone that's young that understands what they're going through. So I think my advice would be for EPs, for doctors, to just put yourself in their shoes. Yes, placing an ICD is an everyday thing for you guys, but it's a major life change for us. We're worrying about our appearance, we're worrying about relationships, like especially in young people. You can conceal having a heart disease. You can look completely healthy on the outside. And if you're having something like an SICD implanted that's going to be showing a little bit, you're now wearing a badge that says, I have this heart disease. Mm-hmm. I actually think it's kind of positive. It says I'm a survivor, but for the most part, I would just recommend that doctors try to be a little bit more empathetic and understanding in that sense.
So how much do you think patients should be directly involved in the choice of their defibrillator, their type of defibrillator?
I think they should be presented with all options, and I think that they should be aware of the risks with each and the benefits of each. It helped me a lot with the decision. The first time around, I wish I had been more informed. I knew that there were some risks, but I was assured these are very rare, yet the rarity happened to me. I think it's just very important that patients are well informed and included in the decision-making process.
And on a day-to-day basis, a week-to-week basis, month-to-month basis, do you have remote monitoring for your device?
I do. I'm very bad with it. My mom actually yells at me about this all the time. Because I travel, so it's hard to bring that along with me. And for a while, I thought that the remote monitoring would only report if you had a shock, and I'm like, well, I guess I can just tell you if I had a shock. But I spoke at something in Chicago, and one of the nurses actually told me it even tells you if it was an aborted therapy. So it's important that you are remote monitored, and I will be doing that much more often.
So how much does this impact on what you do on a day-to-day basis, living your life? Is it something that has changed your life a lot, do you think, or now have you adapted to it? Where are you at?
I mean, when I first had the initial ICD implanted, I felt like I had my freedom back, that I could just go on living life. I had no idea that there was all these things that could happen, that I did have to be a little bit more cautious. But having this now and being as informed as I am, I just feel so much more empowered, and like I can take on the world with this SICD implanted in me.
Yeah, it's good to hear. So sounds like you do. So, any questions from anybody in the audience that they'd like to put to Lindsay?
Thank you very much, Lindsay. This is a very powerful message, and thank you for participating. I'm an implanting physician, and I spend my life talking to patients and implanting patients. And there isn't a day in my professional life when I don't ask myself, what device would I have? What sort of device would a member of my family have under these circumstances, the sort of patient that you typically are? And I think the answer is pretty obvious, and I think that was a strong message for us. Thank you.
Oh, thank you.
Before we sort of round off, Lindsay, can I ask you, are there any particular questions that you think patients should put to their electrophysiologists? Is there a list of questions, key things that you would expect people to ask and that we should have answers for when it comes to choosing the defibrillator?
I mean, definitely talk about the leads more, on the transvenous leads. I had no idea actually how it worked, like how it goes into the heart and it's screwed into there and it develops scar tissue and how hard it is to remove. If I would have known that back then, I think I would have been a little bit more scared. But if you present that to a patient, I think it's an easy choice of what really should be done.
So mainly about the lead and the issues
leads,
to do with the
definitely,
lead.
Yeah. I mean, I guess address the aspect of what it's going to look like. I actually think there should be more pictures of females, because I get females like practically every day asking me what it looks like. I've been out at dinner and gone to the bathroom and like taken a picture of it. I think just be aware, especially if people are young, that they do have those concerns, that this is now a badge that says that they have a disease.
Well, that's great. Well, I think you're extremely brave to come and talk in front of an audience like this. I know that you've done a lot of this before, and you're a very professional actress and know how to do these sorts of things, but it's still a very brave thing to do, because you're talking about something that's so intimate and such an important burden for you to carry through life. It's a burden that you carry with great elegance, and thank you so much for sharing your story with the audience here today.
Thank you so much.
Thank you very much, everybody.